let's just go ahead and jump right into it. So my name is Kendall Wyatt. I'm the instructional content strategist here at Picmonic. I started out as a paramedic, and I'm also an RN, and actually now in my third year of medical school, uh, in doing my rotations here in the Phoenix Valley. So, of course, I work for Picmonic. What does that mean? I do is I kind of work as a liaison between all of our the students and our scholar team to make sure all the information comes together and make sure it's medically accurate and whatnot. So I'm kind of always the voice of the student. I am a student, and that's why I work for Picmonic, because I used Picmonic for my USMLE Step 1 while I'm in med school. So just with that being said, so what is Picmonic? Of course, we're actually right now broadcasting from our Picmonic studio, our sound booth, where we actually record all of our Picmonic audio. So we use text, like text you may see, penicillin, and we turn those into phonetic characters like pencil villain that you see here in amoxicillin for armor ox. So we have over 700 topics for nursing, all these things that we cover, so you can definitely memorize topics faster. So we cover tons and tons of things. So enough about that if you've never used Picmonic, for sure. But if you have any questions throughout this webinar today, one thing for sure is to you have a question box, and you can type into the question box exactly if you have anything as we go through today, or you have a question, or you don't understand something. There's a question box, and you can type in your question, and we'll try to get to it. Also in the background, we have Steve and Brett working in the background to help answer your questions and make sure everything goes smoothly today. But with that being said, let's go ahead and jump right into our topics today. So what we're covering is basically answering questions. Now, you know, there are lots of things to answer questions successfully and do the best, especially at nursing style questions. I always, you know, I was a paramedic first, so I learned the EMS world, and then I went to nursing school, much as you guys are now, and I actually really had to brainwash myself, is a good way to say it. You have to know the nursing process. But something that's really important is to be really honest with yourself and assess yourself. So with that being said, we'll get to that and how to assess yourself, you know, and practice questions and whatnot. We're going to go over how to apply some critical thinking skills, and we're going to run over lots of examples and exercises, and then how to really apply the nursing process and the thought process to the questions we're going to go over today, and then we're going to do a review and a question answer at the very end. So we're going to go ahead and jump right into everything right now. So, oh, my button, there we go. So the first thing is, sorry, I clicked the wrong button here. So we've added some new animations in here, so some of these get a little crazy. One of the things is that you really, to really be good at practicing, to answering questions, is you have to do questions. You have to practice and practice and practice. So one of the things that we have for all of for everyone, for free distribution is we have an NCLEX study plan that we actually have a guide to help you follow through how to answer the questions, and kind of a lot of the written form, everything we're going to go over today, that you can get for free, that we'll email you the link to at the end for coming. Along with that, it's just practice. You know, if you think of the NCLEX kind of as the nursing marathon, you know, you have a marathon, and at the end is you have to do it and do well. You have to train for that over time. You can't just start practicing the day before and think that you're going to do really well at a marathon, especially if you have to answer all 265 questions. You want to be ready and prepared for doing the worst or doing the hardest part, or you know, doing the most work. And doing that is practice, and just like a marathon, you really got to practice it. We're going to go over lots of exercises today. But as you do questions, I can tell you from talking to thousands and thousands and thousands of students, there are really three main areas where you have to assess yourself and really say, where am I maybe having trouble in these areas? One of them is test anxiety. You may have just I have seen, you know, talked to some students who just absolutely have paralyzing test anxiety. Maybe that's you. You may have test anxiety that's just overwhelming. We're not going to go into test anxiety today and how to really relieve it, but we do have a couple of hints and tips blogs out there on our website to help you with, you know, relax before your test. The other thing that's really common is asking yourself and being honest with yourself and say, do I just not know this material? Do I have a knowledge deficit? I kind of got to stuffy nose today for some reason, so I hope I'm not sniffling today. So anyway, I got a little distracted. So if you've been to any of our webinars before, you always get a listen in on all of my corny jokes, and this is action-packed webinar today where I'm going to put as many corny jokes in as possible, for sure. So you may have a knowledge deficit. You may not know the material. And the thing that's really important is as you're practicing questions to be honest and say, well, I have no idea any of my lab values, so maybe I need to memorize those. And that part is definitely the place where we do the best as far as Picmonic, is we can fill in that gap right there of the knowledge deficit. If you have a knowledge deficit, that's exactly where we fill in on memorizing all the content. That's what we're good at and research proven at, is helping you memorize longer. And the next part is really understanding how to choose, or understanding how to solve nursing questions, and that's where I talked about really conditioning yourself. And so if you're new to nursing school in general, then I can tell you right now that you need to start with the basics on how to really answer the questions, and we're going to go over that. But if you are maybe you're ready and you're getting ready to take your board exam, you're ready to take the NCLEX, and you're still having trouble understanding how to answer the questions properly, you definitely need to kind of stop and make sure you do an assessment and find out why. And here's some of these steps are going to help you really get to that solution. So one of the things that's a part of the basic fundamental question answering is making sure you read the entire question. And every time I say this, someone rolls their eyes and they say, "Oh, it's fine," whatever. That's the most basic stuff, and then they don't do it. And that's exactly, I see them actually answer questions and they don't. So here's a good exercise to always do: is read the entire question, pause, and then say, what is this question asking me, or what part of the nursing process is this question asking me? So let's look at this particular one. The nurse is teaching a patient about purple cows. Which statement indicates the need for further teaching? So if you needed to regurgitate that back to me, what is the question going to ask me about? If I gave you answer choices, you should be able to say that I need to know what this patient's going to say that's wrong about purple cows. So if it says cows are purple, that's a correct answer. So that's not my answer choice. If it said cows are blue, cows can fly, cows can do something else. Cows make bananas. Then you would know all those are wrong, because those are incorrect statements. And if you rephrase it back to you, what is the question asking me, you're going to be able to do better, especially if you're really confused, because a lot of these get, you have to understand what it's asking you. And the most important thing all the time, and especially as we're doing our question of the day questions, is students always say, well, I mean, if it's this scenario, then it's probably this, but if it's that scenario, then it's something else. And we don't add anything to the question. That's where you fundamentally went wrong. If you've read a question and then you said, well, sometimes we do this if it's in Hawaii, but if it's in West Virginia, then we do this. And that's where you've already messed yourself up, because you need to stop and then say, what is the question asking me? Because they're not going to ask you to delineate that kind of information. That's what those kind of questions are. That's where you're making your mistake. Ask it what it's asking you. So you need to figure out in that situation which one of those is wrong about purple cows. Another really good thing is identify those keywords. So as we looked at this, which of the following assessments is most likely to be found? When you read statements like this, most likely. So almost always, and this is where students don't read the entire question, and they'll read one of these questions like this, and they don't pause, and they say, what is this question asking me? And then they pick an answer because it is right. But just as every single person if you're not just starting nursing school, you've read a rationale, and there's another answer that's more correct, or the best choice, right? So which of the following assessments is most likely to be found? So that's the one. If I said, repeat that back to me, that's which one is the most correct, meaning there's probably going to be two answers which are both correct, but one of them is more likely to be found. And when you get to those two, then that's how you rephrase the question. Well, which one of these two is more likely to be found? Now, if it's talking about purple cows and you have no idea what a purple cow is, well then you have a knowledge deficit because you've ran into something that you really don't know. And that's how you should think about this as you're creating your marathon run for your NCLEX. So if you're in the beginning, it's going to be a lot more focusing on the nursing process. The next thing is ruling out answers. So, there's a psychology on answering test questions or any kind of questions, and that's you can usually rule out answers. So if you have things that are opposites, like you have two choices, weight gain and weight loss, it's very rare that both of those would be the answer choice. It's very often that one of those is a correct option. So if you had a select all that apply and there's a weight gain and a weight loss, well, only one of those can be correct. And I see people all the time as I watch people answer questions, they always have a lot of problem with that, because then they come down to those two and then I can't really remember. And that's where, if you can't remember the finite details, where you have a knowledge deficit because you can't quite remember. So mark that kind of topic down and make sure you review it again later. So, excuse me, one of the other things that all the time is a priority question. We're going to go over some of this as an example with when you're talking about critical thinking. So you're talking about basic critical thinking skills. You have to prioritize your patients, right? And everyone gets these types of questions. Every single student, every single NCLEX has these types of questions. Which one should the nurse see first? Which of these should be the nurse's priority? Which patient would which of the following patients would the nurse delegate to an unlicensed assistive personnel, a UAP? Well, let's think about each one of those. We have to prioritize them and use a critical thinking skills. Now, critical thinking skills means which one of these patients is the most stable. I can give those to an unlicensed personnel, perhaps, most likely. Or which one of these patients is going to die first, and that's the one I need to go see first. Or which one of these people is going to die without immediate intervention. So if you talk about ABCs, I talk about ABCs all the time, and I always get somebody, as soon as I say this, like, oh, well, CPR, it's CAB now. That's not, that's a layperson CPR. Professional rescuer CPR, we always still think about ABCs as an intervention priority mechanism. So ABCs, well, oh, shoot. I jumped ahead on my slides here. I always end up doing this. Never fails. So ABCs, so airway, breathing, circulation. So if a patient isn't breathing and they don't have an airway, if they don't have an open airway, well, then that's the patient that has to be at the highest priority. And that's where you have to see that one first. Breathing, obviously, if they have an open airway but they're not breathing, well, then that patient still is at the highest priority. And then circulation. A patient who is bleeding profusely still is a less priority of a patient who may not be breathing at all. Or, I mean, I hope I said that right. A patient who's bleeding is a less priority of a patient who's not breathing at all, because the patient who's bleeding, you can't add to the question and say, well, they're bleeding a lot, eventually they're going to die. And that's true, but the patient who doesn't have an open airway is more of a priority because they're going to die faster. And that's how you kind of think about it. Which one am I going to go see first? And then the second part of this prioritizing is Maslow's. And we don't really teach Maslow's as, knowing Maslow's hierarchy itself, but the basic for answering questions is still there. It still is important. And this is our Maslow's hierarchy of needs, Picmonic. But here's what the important thing is to see this Picmonic. There's lots of characters on here if you've never seen our Picmonics, but this is to help, we use characters to help you memorize. But let's talk about how to answer questions with it. And what that is that you know you need to have physiological needs met first. And what are some examples of physiological needs? Give me some examples. Hey, you guys are smart. Everyone's had the basic beginning nursing school class. This is a first or second day, first week lecture, right? Basic physiological needs. And you guys are shouting them out right away. So we know we need oxygen. They're all right here, right? So we know we need oxygen. We need food. We need water. Oh, heck on it, I did it again. I got to stop this little swipe thing on my slides here. We need food. We need water, right? We also need oxygen, food, water, and those are some really basic fundamental things that we have to have, right? And we also have to be able to eliminate, right? We need to be able to go to the bathroom. We need to be able to have basic shelter, and we need to have love. Do we need to have love as far as love and belonging? No, that's not the best answer. But we need uh, like um, what is the word? I feel like I've lost my statement. Oh, sex. Sorry. Yeah, that's right. Marista says it right away. So sex, it's a basic physiological need, but actually being loved is not a basic physiological need. Now, let's put this in order. Which one of those is the highest priority? Do you need to be able to use to urinate and have bowel function before you have water? Well, that's why we've separated them here for you as well in the bottom. The basic physiological needs are water, water and food, oxygen, and those are the basic things, food, shelter, and then shelter. So you have to think about this, prioritizing those same ways. So here's the second level, and those are all things that we're gonna say kill you faster. And every single time I have somebody say, well, I mean, you could live without sex, and that's absolutely true, but as a physiological need. That's why That's why Maslow's kind of gets confusing for so many students. But you have to apply some critical thinking skills with this. You could live without. You kind of have to say which one, is it an acute issue? Is it a serious problem right now? And then we apply that with the nursing process of the ABC, so airway, breathing, circulation. So physical safety is next, right? So physical safety and then actual, having safety, of your actual body is a secondary thing. But if you are in acute danger, then we know that that's very important, because now if you're in acute danger, that is maybe more of a priority, and it's an acute problem. But I feel like I'm just talking in circles. I don't want to confuse you on the topic at hand, the way of thinking. So anyway, let's jump straight to the top. So we have love and belonging. That's important. Self-esteem. Self-esteem is important, but will you die without self-esteem? No, you may not die without self-esteem. Will you die if you don't have sleep? A basic need? Yes, you will die eventually. If you don't have food, water, you will die. But if let's say the highest level, self-actualization, like actually realizing that you're part of society and everything's great. Not everyone even gets to that level in their entire life. So it's definitely not a priority as far as prioritizing questions, and not one you're going to get when you're seeing which one I need to see first, for sure. So we're going to do some questions, and I want to really apply everything that I've said into scenarios. A couple of these I'm going to go fast because I think they're simple questions, but that way we can get to all of the examples that we have in here today. So with that being said, so we're going to just show some examples. Make sure you contrast things, and this is an example of how we show things in Picmonic to really make sure you learn things differently. But anything today like a hypo is going to be a hippo. So here's a hippo head, cow, and then a hyper, or an increased amount, is always going to be a hiker, and we're going to show you a hiker. So if we had this hippo cow, that's for hypocalcemia. If we showed a hiker cow, that's for hypercalcemia, this hypercalcified cow. A hippo head, calcified cow. Just to show you kind of some naming conventions that we're going to use today. So definitely true. So Sabrina asks really quick, if physiological takes precedence overall, where does pain come into play? And the answer here is, if you have a patient that isn't in pain, a patient won't die without pain medicine. So pain really comes into a lot of that, security, physical security, and safety, in the fact of if you are in acute pain, it's not a priority that you manage pain. That's definitely something that is more of a hospital maybe pushing that. You need to make sure you see patients in pain. But if you're just in pain, a patient will never technically die from pain. Now they may become have anxiety, and that increases their heart rate, and if they were bleeding, then they would bleed out. But now we're adding to the question. That's where you need to make sure you don't do that. But pain is an interesting one, because that's something that even myself, I write questions, and I wrote several questions in, maybe even one today, about pain. A patient who's excruciating pain, screaming for pain, which one do you see first? Well, you're not going to see that patient first unless all of your other patients are stable, or it had given you other additional information, because question writers very often will put one of the answers as somebody who looks like they're in severe distress, but I mean they're just in pain, and pain is real, and everyone can relate to pain, but you don't see those patients first if you have somebody else who's in respiratory distress and has a problem, and that's for sure. So I hope that got your question right away. Anyway, here's question one. A nurse is educating a patient for the first time about a medication, metformin. What is this medication indicated for? Very simple, right? Why do we use the medication metformin? I've stopped, I've reworded the question. Why do we use the medication metformin? And lots of you guys already typed in the answer. So, and that's right. We use the medication metformin for diabetes. But look what this question did for you right there. It's made you, even if you didn't know metformin, and I've got our meat farmer character in here because we have a Picmonic on metformin to show you exactly how it works. But if I said hypertension, yeah, okay, diabetes, seizures. Well, I can immediately go to 2, 3, 4, even if I didn't have any idea. And I had to do a Hail Mary, which I never recommend. But if you have knowledge deficit, you know, well, then I need to learn about this med, and I would go look that up afterwards. But acutely, I'm going to say, well, it's probably one of these three in the middle, and I would have to choose one of those in the middle. So hopefully that would then clue you in that this medication is for some type of diabetes, which would then hopefully clue you in to know that it's for diabetes type 2, number 3. So diabetes, we always use a dyed bead pancreas wearing a tutu for a dyed bead type 2, diabetes 2. That's where diabetes mellitus type 2. That's how you should think about it. Now, if you didn't get that question right away, then what you should say is, okay, why did I not get this right? Did I just not know what metformin was? Knowledge deficit? Did I freak out so bad because Kendall threw this question at me really fast? Maybe. Or did I not know the difference between type 1, type 2, insipidus? Like, was something else? Did I not even read the question? Did I not apply the proper processes on the actual question itself? That's where you should really step in and assess yourself. Be honest, because if you're practicing questions, you need to be honest with yourself, because if you're skipping over it, like, yeah, I did great, or I picked the wrong answer, but I'm going to do better next time. Don't do that. That's the worst thing you can do, because you're really crippling. You're not even giving yourself effective feedback to know where you need to learn. So here's the Picmonics on the metformin, the entire Picmonic for metformin, the entire Picmonic on diabetes, and as you can see, it's full of lovely, colorful characters that all mean something. And we're going to talk about metformin in this next question. So the nurse is educating a patient for the first time about the medication metformin. Same medication again. What side effects should the nurse educate the patient about? Select all that apply. Everyone's favorite question, right? And immediately, select all that apply. Sometimes people skyrocket right away and their stress level goes through the roof and anxiety off the charts, right? Well, just chill out, have no fear. Let's look at these. These are easy. Select all that apply. So which of all of the answer choices given, which ones are side effects of metformin? That's what the question is asking me. Does anybody know the side effects of metformin? Anybody want to give it a good shot? I see lots of answers coming in. So several of you are only saying one answer. Remember, this is select all that apply. So it's all the possible answer choices. I'm getting lots of random answers. Makes me really excited to give you the right answers here. So metformin. So quickly, I'm going to jump back to what I said, and here's our metformin Picmonic. Here's our metformin Picmonic. If I quickly looked at this, here's our meat farmer. It's indicated for decrease blood glucose. It's indicated for elevated blood glucose, and it decreases glucose levels and it increases insulin levels to lower the overall blood glucose. We use it in diabetes type 2, diabetes type 2, and as well as PCOS, polycystic ovarian syndrome. But side effects. Let's look at the side effects down here. Side effects are this lake of acid, lactic acidosis. It decreases your appetite. So this X on this mouth because he doesn't want to eat, and it causes GI distress. Really important, GI distress. So GI distress means lots of things, but let's look at the actual question again. So if I look at the question again, now, abdominal pain, nausea, insomnia, hypoglycemia, increased appetite, or decreased appetite. So I'm going to just run through the possible answers here. Some of you guys respond into these things with some very interesting things that I can't repeat out loud, but they make me laugh. So abdominal pain. Abdominal pain itself is GI distress, right? GI distress means your GI system goes nuts. Abdominal pain, nausea, okay, those are acceptable answers. But insomnia, is that anything to do? No. Hypoglycemia, no. And increased appetite, decreased appetite. This is where you need to look. If increased appetite and DP, you know that those are opposites. So let's think about a diabetes medication. If you were just guessing, diabetes medication, and metformin is actually one of the only ones that decreases the appetite, which can then cause weight loss. So if I put weight loss in here, that would be also an acceptable answer. And I tied what I memorized into it. So 1, 2, and 6. And a couple of you guys got the answer and said right away, and that's really good. 1, 2, and 6. And this is a difficult question, but you know that if you knew about metformin and you learned it, then you would know all of those. Because what we know about many types of diabetes medications is that they cause hypoglycemia, but metformin does not cause hypoglycemia. So here's another question. This one is a really interesting one that I just love. Which of the following patients should the nurse see first during his or her shift? I always try to make sure I throw that in. I should fix this one to say his or her. Which one should I see first? So there's a couple questions on the last question. I'll get to those in a second. So which of the following patients should the nurse see first during her shift? A 55-year-old male with diabetes being discharged today. A 67-year-old female who's waiting to leave for physical therapy after a knee replacement. A 45-year-old female patient who returned from a thoracentesis. Or an 84-year-old male with a pressure ulcer who pressed his call light. So which one? Which one? Think about this. That's right. So almost all of you guys immediately shouted went to the right answer. So let's think about this. If you didn't know, and I put this in here specifically because if you didn't know what a thoracentesis was, thoracentesis is you put a needle in between the ribs on the back and draw out fluid out of the thoracic cavity, usually fluid off the lungs, like a pleural effusion. But you would know that patient is at the highest risk of desatting. Even if I pushed if I said this 84-year-old male who's in extreme pain and screaming about he needs pain medicine, that's also still an incorrect answer. So the correct answer is 3, 45-year-old female who returned from thoracentesis. So sometimes, very often, I see students adding to the question, and they'll say, well, you need to go ahead and get rid of the diabetes patients because he's being discharged, so he'll be able to get rid of him so you can get a new patient, or so that you can do a good job. And that's where you're kind of adding things in. Or I could quickly go ahead and see the second patient and then get to all the rest of them. And that's definitely not. You have to apply the nursing process and showing the ABCs and make sure you have that in there. So several of you ask, why is hypoglycemia not the correct answer on the last question? Let's just go back to it. So if you think about metformin is actually one of the medications that definitely does not cause hypoglycemia as a usual side effect. So even somebody said, in their drug guide, it says that it could cause hypoglycemia. And the statement here is, which of the following side effects should the nurse educate the patient about? Well, you're going to educate about the ones that are going to happen. But the fact that metformin could cause hypoglycemia would only occur if a patient took too much of the medication. It does not occur as a regular side effect of metformin. Things like sulfonylureas and medications like that cause hypoglycemia. But metformin, and as a general rule, does not cause hypoglycemia. It lowers your blood glucose level, but to a regular normal range, and it doesn't lower it to a high enough threshold. If a patient took metformin who was not diabetic, they could perhaps have hypoglycemia, but you would never give the medication to a patient who isn't diabetic. So I've added to the question, and that's where you kind of have to be careful to make sure you don't add anything in. Number one things I have to educate to. I'm prescribing this patient's getting a prescribed metformin. Then I know they're going to get these side effects. These are side effects that they should expect as a possibility. This rare side effect if you overdose, not something I would want to do, unless it includes basic education. So I'm, educating about tetracyclines. Well, I want to make sure that I tell those patients do not consume milk or antacids or iron because it binds to the medication and inactivates it, because that's a standard education with that particular medication. And that's kind of how you have to think about that. Hopefully that answers your questions for those couple of you that had it. So my mouth is super dry today, and I don't know why. So I forgot to mention this in case you haven't been to any of our webinars before, but I take all these drinks because, one, I have dry mouth, but secondly, because I get, 37 cents every time I show this Picmonic cup. So I've made about $4, I think, so far, and I'm really excited about that, for sure. So Elaine asks, is that butter on a troll? And the answer is, this is a really fun character, and this is the Ab Butter Troll. So we'll get to that in a second. So as a nurse, you've gladly volunteered to do a presentation at this brand new club formed in the pediatric unit called Asthmatics Anonymous. What education should you include regarding rescue inhalers? Select all that apply. This is a select all that apply question. Select all. Laura says, I always say that I made $4. Well, that's $4 per webinar, right? I don't know. I don't keep track. I'm letting you guys do that. So let's think about this question. So this is one that I wrote for fun. You're not going to see one that's going to have crazy Asthmatics Anonymous for you to try to say, well, what is Asthmatics Anonymous? The idea here is, what education do I need to provide to asthma patients who are using inhalers, rescue inhalers? So immediately, I've tried to trick you, if we're going to say that I tried to trick you, right there with rescue inhalers, because rescue inhalers are not inhalers that you would use every day. That's something that's very, 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 very important. And after I've pointed that out to you, most of you are probably going to change your answer. So let's think about it. Rescue inhalers. What is most likely in a rescue inhaler? Albuterol, right? Yes, there are other things, and that is absolutely true. So let's look at the possible answers. This medication may cause chest tightness. Okay, albuterol is definitely a beta agonist medication, right? Maybe you didn't know that, but you should, and that could cause an tachycardia. We always see that as a side effect. So you should always, think about that as well. We give my patient a beta agonist, well, they're going to have an increased heart rate. You may experience weight gain, and I see lots of you guys who had 2 in there as your answer, but what were you thinking about? And call yourself out on it. That's what you need to do really well questions. Call yourself out and say, why did I pick that answer? Well, I picked that answer because I was thinking asthma, and I was thinking a steroid inhaler, and steroids make you fat, right? But we're talking about rescue inhalers, because you didn't reword the question back to yourself. You didn't read the question and say, well, what this question is asking me about, what education do I need to include for rescue inhalers? Rescue inhalers include things that have mostly albuterol in them. That's definitely what you need to think. Yes, and Tracy says it'll say select all that apply, and yes, it usually does. I forgot to type that in here for this one, so sorry about that. And number 3, your heart rate may increase after using this medication. Well, if your heart rate increases, yes, it's a beta agonist. Your heart rate's probably going to increase, and you may have chest tightness. And when I say chest tightness, I'm thinking about angina. Angina. You could have that, because we're telling you about the first time. It doesn't cause it every time, but that's right. And number 4, be sure to rinse your mouth after each use. Now, that is a standard thing for every inhaler. Every single inhaler, because what do inhalers cause? What happens if you don't rinse your mouth? Does anybody know? This is important. A lot of people know to remember to say rinse your mouth after every use, but they don't know why. Oh, you guys are good. Liz and Lance right away in a second says fungal infection and candida or thrush, and that's right. Especially inhalers that are steroids, but also ones that are albuterol. Anytime you use them, so you're causing the medication goes in your mouth, and you inhale it, and when you inhale it, it causes the possibility of killing the bacteria in your actual mouth, the good bacteria. So then the fungus, like thrush, candida, overgrowths and causes this cheesy-like substance on your tongue, and that's definitely what you have to think about. That's really, really important, and for sure. So Elaine says, and Elaine, so I'm just going to, let me just back up really quick. So this medication has a narrow therapeutic index and will be monitored closely. If you picked number 5, what medication were you thinking about incorrectly if I said number 5? Somebody said 5 in here. I know they did. Yep, a couple of people said 5. Theophylline. Ah, right. That's right, Shantae. Theophylline. But theophylline is not administered via rescue inhaler. It's administered IV. It's not a medication that we give through an inhaler. And that's where you've really got to have that knowledge. You have to have the base knowledge to get these right. So backing up just a second here to Elaine. Oh, I think I lost her question. Okay, sorry. So Arwen says, why does it cause chest tightness? Well, it causes chest tightness because number 1 and number 3 are technically the same thing. If you have this increased heart rate, then if you have an increased heart rate and you're already at risk of angina, it's going to make it worse right away. That's definitely true. And I don't know how I lost Elaine's question, but oh, there it is. Oh, that was the same thing. That was her question. Okay, good. So let's move on. Here's another one. So here is albuterol. Here's part of our ab-butter-troll Picmonic. And this is how you could have got all this right away. Immediately, I'm going to remember, I would recall the ab-butter-troll because I love this little sexy beast with his blue hair swooshed over. And I think about him, albuterol, this ab-butter-troll. And I'm going to remember our Picmonic on it because I'm going to remember immediately that I have to rinse my mouth, this rinsing mouth. And I'm going to remember this tachycardia, this tach heart card with this angel. This angel with chest pain is for angina. I'm going to remember all those things as an image so I could quickly recall albuterol as a medication. That's really how you have to think about it, for sure. Definitely. So Rena asked if I could repeat really quick why the patient should rinse their mouth. And you need to rinse your mouth because anytime you use an inhaler, it causes the possibility of disrupting the bacteria, the normal flora bacteria that are in your mouth, and lets fungus like candida overgrow, lets them grow like crazy. And it could happen actually really easy. And someone actually typed in there that, I've been using inhalers all my life, and I've never rinsed my mouth. Well, you're making a fundamental flaw there in the fact that you are applying knowledge from this one time that I saw this once, and it's not a mainstay. And that will get you in a big, big, big trouble when you answer questions. You should never do that. I actually used to do that a lot, especially when I first started nursing school. Well, I mean, this one time I was in the ER, I had this patient, I took them in, and they didn't do that, and that's where you're wrong. You have a knowledge deficit because you need to read all of the possible scenarios to remember all of the possible answers. Definitely true. So let's look at this question. While doing a morning medication administration, the nurse notes that a 65-year-old male patient she is giving medications to has a heart rate of only 48. Which of the following medications should be withheld? Pause. What's the question asking me? Excuse me. The question is asking me, which of these medications should not be given to a patient who has a heart rate of 48? I've reworded the question exactly to say, what is it asking me? So which one of the medications should not be given? And it's only one answer. It's only one answer. So which medication should drop the heart rate? That's right, Elaine. That's exactly what you need to ask. Which medication drops the heart rate? Because if you gave this medication again, it's going to drop the heart rate more, and this patient could be in dire distress. And that answer is Pendolol. 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 That's right. You guys are doing good. So we know what kind of medications drop heart rates, and that's beta blockers. So let's look at the Picmonic with the answer on it. So someone typed in that, yeah, I saw this question before, and that's right. We used this question for our question of the day 2 days ago. So let's look at it. That's how you reword it. So beta blockers, I'm going to recall beta blockers themselves. I'm going to recall this beta fish with this beta fish on top of her blocks, and then I'm going to remember that it decreases the heart rate, this down heart rate timer. Now, if you've not used Picmonic, this is only part of the actual image for a beta blocker medication. But you say, well, how did I know Pendolol is a beta blocker? Well, that's because Pendolol ends in OLOL. So I can always remember a beta blocker, this beta fictional block with this OLOL lollipop right here. It's a beautiful little lollipop, always is a beta blocker medication. So pharmacology is one of the most anxiety-provoking things that nursing students have, right? It is the most anxiety-provoking. All these drugs, I don't know what to do. And every single time I sit down with students, and I used to do tutoring. I don't do one-on-one tutoring anymore, but when I used to, I would sit down and they would just be so upset. How do I remember them all? And that big thing is memorizing the drug endings. We have an entire pharmacology webinar that we did, and I think you can go see it on YouTube as part of our series. But it's mostly about making sure you memorize the pharm endings, because you can maximize what you need to know by knowing the endings, and then you know all the beta blockers and all of their side effects. So let's look at this next one. A 45-year-old male patient with end-stage renal failure has a hemoglobin of 7.2. The nurse would expect the patient to be started on what medication? Oh, crap. That's what you need to say, right? Oh, my goodness. While you're thinking about that one, Ariel says the webinar on pharm was so helpful. And it's great, Ariel. I don't know if you say your name Ariel, but I actually like to pronounce it like that because I like The Little Mermaid. So, all of you guys are putting in their answers, and those are excellent choices. This is only a one-answer question. Normally it says select all that apply, or I'll tell you. But it would say select all that apply, always. So I apologize for not putting that on the other one. So what is this question asking you? This question is asking you it's asking you two things, but it's given you this extra tidbit of information so that you can solidify that you know you got the right answer. And what you need to say is, which medication would I give to a patient in end-stage renal failure? Or maybe I can't remember end-stage renal failure. Which medication do I need to give to a patient that has a hemoglobin of 7.2? Okay, also possible. But let's think about all of it together. The nurse would expect the patient to be started on what medication? Well, which one do we have to start on? End-stage renal failure and a hemoglobin 7.2. If you didn't know right away, the normal hemoglobin in a male patient is about, 12 to 16. That's where you immediately should have said 12 to 16, so this is too low. This is too low, and we have an entire Picmonic for all the lab values. You can remember all of them. They're so easy. And I wish I could have put our hemoglobin here because it's one of my favorite ones to play for everyone. But end-stage renal failure. This patient is just in renal failure. What do we know we have to give him? So do we give him iron because he has a hemoglobin of 7.2? No, that's really low. That's a serious problem. Yes, we could give him a blood transfusion, but that's not an option. There's no answer for that, and I'm adding there, right? This patient isn't in acute distress. So what do I give a patient in end-stage renal failure? I give a patient in end-stage renal failure erythropoietin. But why do I give them erythropoietin? Because without kidneys, you can't create erythropoietin. Erythropoietin goes to the blood cells, to the bone marrow, and stimulates them to make the RBCs mature. And if you didn't know that, well, then maybe you have a knowledge deficit. You didn't quite know why erythropoietin, or what it was. What's filgrastim? Well, it might be filgrastim. I can't remember right off the top of my head. But anyway, it's also a it's a stimulator of bone marrow growth, but we know that the underlying problem right away for patient in end-stage renal failure is the fact that they don't have erythropoietin, and that's how we would know. Why do we give Kxalate? Just really fast. Kxalate. Why do we give it? You have a half of a second to type in Kxalate. Wow! Right away for hyperkalemia and elevated potassium level. And we can give Kxalate an enema. We can give Kxalate. We can give it by mouth, and it binds to potassium and lets you actually just poop it out for sure. We give iron in a patient who's iron deficient for iron deficiency anemia, or a patient who has a chronic bleeding problem. So if I said a 45-year-old, let's start over. A 20-year-old female patient with excessive menstrual bleeding has a hemoglobin of 7.2. The nurse would expect the patient to be starting on what medication? What's the answer then? Then the answer is iron, because this patient they have periods, or any female patient who is menstruating is at very high risk for iron deficiency anemia because they're bleeding and they need excessive iron so that they can create more blood cells because they have a problem actually producing red blood cells. And that's how you need to think about this. That's really exactly how you need to think about it for sure. It's really kind of the that's how you got to think about it. Calcium, yes, a patient in end-stage renal failure could potentially need calcium, but would we give that as a priority? No, it's not the priority at all. That's definitely not the priority medication. So let's look at another. Here's our Picmonic on erythropoietin. So we have this earth red Putin here, one of the really crazy characters. It's always a lot of fun, and you can remember the earth red Putin with chronic renal failure because we always put that in there. That's one of the indications of why you would give erythropoietin for sure. So let me just look here. We got a couple questions. So what's the generic name of Kxalate? Because those are used on NCLEX from now on. So that's true. You need to know generic names. And for Kxalate, it's sodium polystyrene is one of the really ones, and there's oh god, it's sulfa something. Sodium polystyrene sulfonate is the actual chemical name, but you're probably going to get Kxalate for it, but it's sodium polystyrene sulfonate. That's right. I'm sure of it. Oh, TR says really quick, is filgrastim for white blood cell increase? And that's right. It is mostly for white blood cell, maturation. That's right. So for sure. I try not to jump off too much because I know everybody doesn't have all the same questions. So let's look at this next one. So next question. Oh, never mind. Look what I did again. Every single time I click the button here. Oh, I skipped to the answer. Nobody look. Okay. The nurse is assessing the patient who is taking the medication hydrochlorothiazide. Which of the following side effects would the nurse be concerned about? So this is a select all that apply question. I forgot to put that in there again. I've done you guys a poor injustice with that. Select all that apply. So this is more than one answer. Ah, my nose is itching. Oh, you guys are doing really well with this one. So, a couple of you guys saw the other webinar. So I include hydrochlorothiazide as one of my really common ones because I know we give the other medication that's a diuretic pretty common. So hydrochlorothiazide. So ask yourself, what are side effects of hydrochlorothiazide? Hydrochlorothiazide. I have this Tarzan hydrant right here. What do we know are side effects? And you guys, pretty much all of you, right on the head. And a couple of you missed it, but that's okay. Right away, if I'm giving a diuretic, I'm getting rid of fluid. So I have a potential of having a decreased fluid volume. Exactly how you should think about if I give you, I'm going to give an antihypertensive, would I give it to a patient who has a low blood pressure? No, I would not. That's definitely, if the indication of the medication, what it does is already to an extreme, we are not going to keep giving him a medication that's going to do that. But here's the important thing with diuretics, right? Diuretics, we know diuretics get rid of everything. Well, they get rid of fluid, but they also get rid of sodium. They get rid of potassium. So hypokalemia, hyponatremia. Hypokalemia is a side effect of all diuretics except potassium-sparing diuretics, right? I hope that's common sense for you. Or if not, I've just given you I've just made your mind blow. But let's think about why hypocalcemia is not an answer. What is the drug? What is the drug that causes hypo? That would be all of the answers. Oh, Sona asks, why not number one? Well, that's because hydrochlorothiazide is different than loop diuretics. Because loop diuretics work in the loop of Henle, and loop diuretics lose calcium. Loops lose calcium, and I've said that before. I'm saying it again. Loops lose calcium. But hydrochlorothiazide works in the distal convoluted tubule in the nephron, and it has a side effect of hypercalcemia. It holds on to calcium. It gets rid of everything else except for calcium, and it could cause, for sure. Oh, Natalia says I spelled hypocalcemia wrong, and you're right, I did. I spelled hypocalcemia wrong, so I apologize. I'm just gonna cover it up with my fingers so that I can't see that it's hypocalcemia. Steve sent me a message and says shame. He's playing the shame bell for me, so it's definitely true. Oh boy, so it's been a long day. I apologize. So let's look at the hypocalcemia Picmonic, and this is I promise we spelled it correctly in there because we double checked that like times 100. For these webinars, I don't have as many double checks as I would like, and I'm going to blame that on Steve right now because he's sending me hate messages on my phone here while I'm talking. So here's hypocalcemia, this hydrant chlorine taurazine, right? Hydrochlorothiazide. And we can see right here, you can have this empty canteen for dehydration. You can see hippo, remember, hippo salt shaker, hyponatremia, or you can have hippo banana or low potassium, hypokalemia. That's how you need to think about it. Tracy says I'm losing 3 cents because I spelled that wrong. And I believe it. It's absolutely right. Kimberly says she understands why hypokalemia but not hyponatremia. And what you have to think about is with diuretics is that they just dump everything. Except, remember the outliers. Diuretics as a whole get rid of everything, right? Except the special ones. Loop diuretics get rid of everything. But everything else, you have to think about that they hold on to specific things. So hydrochlorothiazide holds on to calcium and causes hypocalcemia as a side effect. Potassium-sparing diuretics hold on to potassium and have hyperkalemia as a side effect. And that seems really common sense, but definitely it's definitely something that students have a lot of trouble with. So it's definitely very, very, very common. So here's another one. This is a fun one of mine. A 16-year-old cheerleader is upset after her boyfriend of 2 months, such a long time, broke up with her. She's breathing at a rate of 30 respirations a minute. Which acid-base imbalance should the nurse know the patient may develop? I mean, I feel so sorry for her. Felicia is so upset. She's breathing at 30 times a minute. I mean, that's pretty fast. We know that a normal breathing rate is what? Immediately, you know the normal. Is it normal? No, it's not normal. It's not normal. That's right. It's not normal. You guys are, I'm impressed. You guys are jumping, most of you are jumping straight to the answer. So 30 respiration minutes is fast. So if I only teach you one thing is that if you're breathing really fast, you're blowing off CO2. And I have an entire acid base webinar. It's on YouTube that you can go listen to, and we're going to be doing it again live in a couple of weeks. But if you are weak on acid base, let me teach you a really, really important point. Acid base, oh my goodness, I can't remember. It's awful. I hate it. I'm just going to skip those. You don't need to. It's so easy. If you think about respirations, if you breathe really fast, if you breathe really fast, then you're blowing off CO2. So if you get rid of CO2, then you have the possibility of getting rid of too much acid. So if you get rid of too much acid, then you're going to be alkalotic, right? And if it's a respiratory problem, it's respiratory alkalosis. That's right. You guys are definitely on it. I'm impressed. And there are some things you have to memorize with acid base. There are some basics. So let's look at some basics. Here's part of the Picmonic for respiratory alkalosis. And one of those is, if you can remember this, elk with the L sign loser on his head, this respiratory elk loser right away inside the Picmonic, you can remember that there's a hiker for fast or elevated vent, hyperventilation. Oh, sorry. And you'll remember that with hyperventilation also comes possibility of anxiety in those types of patients. All the time. Every time you think of somebody who's hyperventilating, it's probably anxiety or especially in a young patient. So what's the intervention that we give patients that are breathing too fast? What do we give them? Let's just think about that. What is an intervention that we would give somebody who's breathing too fast? I mean, I've cheated right here for you, right? We'd give them a paper bag, or we'd make them breathe into their cupped hands. We'd give them a paper bag so that they blow out their CO2. They blow it out, but then they're rebreathing it, so they're not breathing too much oxygen. Because somebody who's hyperventilating ends up doing what? They pass out. And one thing I know from being a paramedic for so long is that you have a patient, you show up and they're hyperventilating. Well, you can just sit back and relax. Enjoy it. You go ahead and breathe. Have your anxiety tech, sister. You can breathe 1,000 times a minute. You can freak out all day long you want, because I'm just going to sit here, and what's going to happen, you're going to blow off so much CO2, you're going to pass out every single time. You're going to breathe so fast that you pass out. But why do you pass out? Well, you went into respiratory alkalosis, and you've blown off too much CO2, and that's your body, your brain saying, whoa, reset, and you pass out. And then when you pass out, you wake up. And if you freak out again, then you wake up. And hopefully you have a regular breathing rate. Liz actually points out a really important thing, and she said, I heard we don't tell people to blow into a paper bag anymore. So let me tell you what will be on your exam. I actually have a very torn on this, because I learned when I was a paramedic that we don't tell people to breathe into a paper bag anymore. But actually, in the textbooks, most recent versions of textbooks, it does say breathe into a paper bag. So I learned a cupped hands or a paper bag. So you can breathe into cupped hands is a possibility, or a paper bag. But what I can tell you is that it will be an answer of one of the three. They're not going to give you cupped hands or a non-rebreather mask. We wouldn't really use a non-rebreather mask or a paper bag. But if you had choices, paper bag or a rebreather mask, you're probably going to put them on the rebreather mask, whichever one is an actual medical intervention, right? I mean, I hope that makes sense. But it's kind of one of those things that's definitely, you need to make them stop blowing out all of their oxygen and, blowing off all their CO2 rather. So you need them to rebreathe some CO2 to keep that CO2 level elevated, because what makes you breathe? What makes you take a breath? What is it that makes you take a breath? It's CO2. So if you blow off all your CO2 and you don't have any CO2 anymore, what happens? You pass out every single time. And that's why you can sit back and kind of watch the whole system work. So that's definitely true. Liz says she has a book that says, calm the patient. And that's true. You need to calm the patient, but they're not going to give you those. If it's an anxiety patient, yes, the answer is immediately try to calm the patient, but usually they don't. The best intervention is then have them bring into a paper bag or cupped hands to make them, the idea is that you need to fix make them rebreathe. So let's think about it. Oh, excuse me. We talked about 550 million things today. I'm going to make 37 cents really quick. You need to really ask yourself some serious questions. What we went through today was exactly some examples of some question scenarios. And if you didn't, if you freaked out, maybe I made you so nervous you didn't know what to do, you couldn't pick which answer, then you may have problems with test anxiety or relaxing yourself or saying, I'm in the right mindset, I'm going to get the right answer, I'm good, I got this. And that's where you need to focus. Maybe you didn't know the answer because maybe you skipped over diabetes medications. Maybe you really don't know acid-base that well. Maybe you didn't really remember anything to do with the diuretics. You have to ask yourself. No one can do that for you. There's no one out there that can do that for you. You have to be honest with yourself, and you have to make a list. And I know every single nursing student, we surveyed students, hundreds of students, and almost every single student actually told us that they do some type of exit survey, exit test. So whether you're doing HESI or you're doing ATI, you're doing Kaplan, whatever it is, almost every single program across America that we surveyed requires some type of exam. And those exams tell you where you're weak in subject areas. So don't lie to yourself. You're cheating yourself by doing that. If you don't know something, you need to fill in the knowledge gaps. And that's where, I hate to say it, but that's where we're best. That's where Picmonic is over the top, helping you memorize all those nitty-gritty crazy details. Metformin, lactic acidosis. Metformin, if you're about to take a CT scan, you need to stop metformin because it's going to cause very serious side effects, for sure. But also understanding how to choose. You really need to be good at critical thinking and thinking through the questions. And that's what we're here for, to help you run through these exercises and really give yourself a reality check. And at the end, of course, no matter more than anything, is practice, practice, practice. Really work hard on the questions. Do a lot of them. And as you're practicing questions, you're going to realize whether you just do really bad at questions or you really just aren't good in these 15 subjects. Maybe there's 100 topics and you're really bad at 30 of them. Well, what I can tell you, you hear all the time, I hear this all the time, well, NCLEX will find your weaknesses. It's going to point out your weaknesses. Well, That's not really true, but it is true in the fact that if you skipped over an entire subject because you didn't want to learn gynecology, Kendall, then it's going to find those weaknesses, because what happens is you're not going to be able to answer the select all that apply questions for gynecology and obstetrics, OBGYN, as well as you will be everything else. And then you're going to have to do more questions to get those right. So if you have any questions, type them in there in the question box, and we're going to get to those right away. Tracy says she loved this webinar, Kendall, and you're welcome, Tracy. If you have any other questions, we have other ones on our our YouTube channel, Picmonic Video, but that's definitely where you can go to get more topics. So we actually are covering, we have this great plan, and we're going to complete it, of having an entire nursing review series of how you incorporate all the Picmonics for all of them. So you can also go to picmonic.com, and check events, webinars, and see all the webinars we have scheduled. We have one scheduled next week, and actually for several weeks going on. Michael says, I'm going to definitely join the Picmonic family. Seems I can understand this method. Well, I recommend it and welcome aboard. So let's just see what we have here. Oh, lots of questions. Elaine says, you can't unsee the sensual butter troll. And that's absolutely true. We actually focus on pointing out the unusual. So maybe you didn't know, you've never heard of Bernard-Solier syndrome. And actually, this is one of our characters right here for Bernard-Solier. It's a St. Bernard soldier, Bernard-Solier syndrome. Not really a nursing topic, but definitely a really great character that we have. So. Tiara asks, why can't metformin be given before a CT scan? And that's because of the increased risk of, definitely with side effects, especially like lactic acidosis, for sure. So metformin's an interesting one, of making sure that you don't give it with or before any patient would go under a series of patients with contrast dye, because it can cause serious kidney problems. Lots of questions in here. Oh, Pam asks about webinar on drug calculations. We don't actually have one on here, but I've not done one, but if we, I mean, I wouldn't be opposed to doing a good drug calculation one. Definitely good on some good, drug calculations are always a fun topic. Let's see what we have here. I know I skipped over some questions. Oh, so Diana says test anxiety is me, or for me. Test anxiety for me. How can I help myself? One of the things I can definitely say, Diana, is that you need to just find your happy place. You know, I always tell people this. If you, it's hard for me to actually see your reply right away because there's so many replies in here. But if you are currently in nursing school, what I can recommend for every single person, there's one thing I can recommend, is that you really have to find your happy place before every single test. So every single actual exam in your nursing curriculum, right? Remember, we're marathon runners here. You are taking tests every single week, or every 2 weeks, or every month, and those are just gearing you up for the NCLEX, the final one. But you have to be in the right frame of mind to really just be ready to go in and kill NCLEX. You need to be, I mean, everyone wants to be able to walk in with confidence. And you need to focus on getting over your test anxiety for your little tests. And that is one of the things I did, was I actually believe in the use of two things. One is happy pictures. I have actually a collection of pictures of things that just make me happy. One of those is my dog Stitch, which you saw in the very beginning of my intro video, or intro image. But my dog Stitch, he makes me happy. So I have a picture of him in there. I have a picture of my family. I have pictures of some amazing places around the world where I love. Scuba diving, which I absolutely love to scuba dive. I have some of my favorite scuba diving places. And what I can do is when I look through this 15, 20 pictures right before any time something is about to come up, it really calms me down. I look through, I'm like, yeah, I'm going to go there. It's a beautiful island. I'm going to go on this vacation. It's going to be amazing. And I can think about things other than, oh my God, what am I going to do for this test? It's crazy. And the second thing is really just I forgot the second thing. I saw a squirrel and I got distracted. But you have your happy pictures, and those are going to take you to a really relaxing, nice, calming place. And the second one is kind of really just like finalizing the goal, not seeing yourself today or what I'm going to do today. Oh my God, these questions awful. What I'm going to do is picture yourself in somewhere with success. At the final goal, how you've already passed. Picture yourself having already passed. And the other thing I actually kind of enjoy that's a little bit of a secret is before every single test, I really just like to play some music and dance. And I used to do it in the parking lot with several of my nursing buddies, and they would tell you that it was definitely a lot of fun. But I just played some music out of my car stereo, and we all just danced like crazy in there. But definitely avoid, one thing for sure, is avoid going into any exam and seeing all those people who were all freaked out before your exam outside the room, all chattering like, oh my God, did you review this? Did you review that? Did you review that? Everyone always freaks out. That's definitely for sure. So avoid all that nonsense. Um, mm, mm, mm. Let's see. Oh, Alexander asked, what's Filgrastim used for? So it's used for like a low blood count, white blood cell count specifically usually. It increases progenitor cells to actually stimulate cell growth at the bone marrow level. As far as patients who usually with uh, like a patient who is like cancer and things like that, they have a low white blood cell, and we want to give them this medication to increase it. That's definitely for sure. So, um, do do do. Rojan asked, I'm not sure if you said that right, but are we going to have a webinar for OB? And yeah, we plan on having a webinar for OB, but I don't have the date here right in front of me right away. So, okay, so definitely some more questions in here. So I don't know that I can get to all of them right away, and skipping through them, I'm going to bore you guys to death. But the last one I see, just really quick, is Rena asked, are we going to have a webinar on diabetes? And we're actually having an endocrine webinar next week, I believe. So go to picmonic.com/events and look on there. So that's for sure. Okay, so definitely some more questions in here, but a couple of them we won't be able to get to. So here's the thing we want to do for you is if you have any questions that we didn't get to, you really have something else, go to feedback@picmonic.com and send us an email. We're here for you. We have our, not just myself, our other scholars, Steve and Brett, we're all here for you. Our entire marketing team's here for you if you have any questions. Maybe you have some problems. I'm telling you, we've been there, and our entire team, if we have not, which is rare, we know somebody who has, and maybe we could even connect you up with the resources. So just shoot us an email, feedback@picmonic.com, and definitely hit us up if you have any other questions. Other than that, have a great day, and good luck studying. We appreciate you coming today. See you next week.